Most Americans can look around and see what's happening. They see people dying and suffering. They know that this is a real problem. And I want to thank everyone, especially essential workers, including nurses, grocery workers, doctors, bus and train drivers, even delivery persons, chefs that don't have the luxury of working from home. Those that also are staying at home and understanding that this is saving lives. And it really breaks my heart that when you watch these protesters who feel they're part of a civil rights movement, and with places reopening around the country, with you thinking, what was it all for? Well, your lives do matter. And to those protesters, I have one thing to say. Your individual liberty should not outweigh the promotion of public safety by our elected leaders, and the need for this country to safely reopen only when the United States builds a testing infrastructure capacity. It is May 17th, 2020, and we are in no way close to where we need to be. America is running around 300,000 tests a day, and that is nowhere close to where this country should be at. So don't listen to Trump, and don't listen to what he's saying.
Our great companies came up with things, Abbott Laboratories and so many others. They came up with things at Roche. They came up with things that nobody even believes. So we have the best testing in the world. It could be the testing's, frankly, overrated. Maybe it is overrated. The states, and many states that I'm talking about, they don't have a problem. We have some big problems, but it's confined to certain areas, high-density areas. So why would we test the entire nation, 350 people? With that being said, I'm going to say it again. We tested far more than anybody else. We have the ability to test. I mean, we've come a long way from an obsolete, broken system that I inherited. We have now tested with the best test far more than anybody else. When I say anybody else, I'm talking about other countries. No country is even...
Today, New York Governor Andrew Cuomo accused the president of shifting the burden of testing to states without providing resources to do it.
The state should this, the state should this, the state should this. Yes. Well, what support have you given the states? Competing with other states, I'm bidding up other states on the prices. Because you have manufacturers who sit there and California offers them $4, and they say, well, California offered $4, I offer $5, another state calls in and offers $6. It's not the way to do it.
Administration, we believe in two beautiful rules: buy American and hire American. This afternoon, I also have great news on testing. You know, we've been doing testing at a level that nobody's ever done it before. We cannot get the press to write about it or write fairly about it. And nobody has ever done. We've done double what anyone else. If you add up all of the countries in the world, we've done more testing than all of the countries in the world added up together. Nobody's ever done anything like that. And we have the best test. We have tested 2 months ago, didn't even exist.
Yeah, because they didn't exist 2 months ago, when we needed them the most.
These COVID-19 testing kits are ready to fly from South Korea to the United States. Seoul has previously sent diagnostic test supplies to American cities, including Los Angeles, but this load, shown here in video released by the South Korean Ministry of Foreign Affairs, is capable of running some 600,000 tests for the novel coronavirus and marks the first bulk order by the U.S. federal government. It comes 3 weeks after President Donald Trump requested medical devices in a telephone call with South Korean President Moon Jae-in on March 25th.
U.S. President Donald Trump also sought urgent help for medical equipment such as diagnostic test kits yesterday. The government will fully support your company's exports.
South Korea and the U.S. both confirmed their first cases of COVID-19 on the same day in January. Seoul made an early and urgent push to mass-produce diagnostic tests for the virus, and several firms quickly produced rapid testing kits. But American efforts at early testing stalled. A first government-produced test proved faulty and had to be reissued, and regulators were slow to approve commercial laboratory tests. Those failings meant officials were unable to track the virus as it spread to all 50 states.
How did South Korea test so many people so quickly, but we didn't even test a fraction of that number?
The shortfall in American testing quickly became apparent. A lawmaker expressed her frustrations in March.
South Korea has now tested more than 196,000 people, but we are not anywhere close to that. This is the United States of America. We're supposed to be leading the world. Instead, we are trailing far behind.
Once struggling with the first large outbreak outside China, South Korea has largely managed to bring its coronavirus cases under control. Last week, Seoul announced the daily number of new infections had fallen into the 20s. South Korea credits part of its success to moves by government officials and private companies to develop and secure regulatory approval for tests, allowing the country to quickly test thousands of people. As of Tuesday, Seoul reported it had so far run more than 500,000 tests, discovering about 10,500 cases of the virus in the country and just over 200 deaths. The United States, in contrast, has recorded more fatalities from COVID-19 than any other country, with nearly 24,000 dead as of Tuesday. Testing in the U.S. has picked up significantly since March when Trump phoned Moon. According to the COVID Tracking Project, the U.S. has, of Monday, tested nearly 3 million samples for the novel coronavirus and averaged close to 150,000 tests per day last week.
And I know people that got infected, and some ended up getting the test and paying almost $270 for it. But others were turned away as soon as May 11th, 2020, because the hospital here in Chicago deemed that person not showing enough symptoms. And then, by the way, that person got charged, wait for it, $11,000 before insurance, landing the patient $1,700 in out-of-pocket costs for just assessment by the hospital. It's crazy what's happening here in America. No wonder why the leading cause of bankruptcy in the USA are hospital bills.
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test. If there's a doctor that wants to test, if there's somebody coming off a ship, like the big monster ship that's out there right now, which, again, that's a big decision. Do I want to bring all those people on? People would like me to do that. I don't like the idea of doing it. But anybody that needs a test can have a test than any country on earth by far. These are all different products that were literally just developed. These are the best machines and the best equipment anywhere in the world, and other countries are calling us. We have met the moment, and we have prevailed.
I think it's clear that America does lead the world in testing. No one beats America. No other country in the world comes close to the total numbers. No matter how you look at it, America is leading the world in testing.
We are tested. We have great capability. You look at all of these machines here, they're incredible machines, the best anywhere in the world. No place in the world has this kind of equipment. Other countries are calling, sophisticated countries, and they're calling, lots of countries. This is a 5 to 15 minute test. As an example, the Abbott Laboratories test. These tests are highly sophisticated, very quick, very good. This is things that didn't even exist a short while ago. So we do have a great testing capability.
You said in your comments earlier, we have met the moment, we have prevailed. To you, sir, is the mission accomplished, even with 1.4
No,
million?
we prevailed on testing is what I'm referring to. That was with regard to testing. We have a great testing capacity now. It's getting even better. There's nobody close to us in the world. We certainly have done a great job on testing. We have prevailed. We have the best equipment anywhere in the world.
You're now promising that everyone who needs a test will be able to get one. When will that be a true statement exactly?
Well, it's a true statement already. We have more testing than any country in the world by far. We're doing so well on tests and so quick and so fast, 5 minutes, etc., and so accurate.
Why hasn't testing gotten up to the point where every American who wants a test can get a test?
They should all be able to get a test right now. They should be able to get a test. That's the problem with a question like that. We go through a whole announcement saying we're number one in the world by far, by a factor of 2 and even 3 and 4, depending on where you're looking. And I get a question, when will everybody be able to get tested? If somebody wants to be tested right now, they'll be able to be tested.
You've said twice here today that every American who wants a test can get a test.
Yes.
That's not the case.
Not everybody should get a test because they have to have certain things and they're going to know when they're not feeling right. Those are the people that will be getting the test we have now, and nobody says it. They just don't want to write it. By far, more tests than any other country in the world, not even a contest. And the quality of our test is the best anywhere in the world. If people want to get tested, they get tested. We have the greatest capacity in the world, not even close.
You've said many times that the U.S. is doing far better than any other country when it comes to testing.
Yes.
Why does that matter? Why is this a global competition to you if every day Americans are still losing their lives and we're still seeing more cases every day?
Well, they're losing their lives everywhere in the world. And maybe that's a question you should ask China. Don't ask me, ask China that question, okay? When you ask them that question, you may get a very unusual answer. Yes, behind you, please.
Sir, why are you saying that to me specifically?
I'm
That I
telling
should
you,
ask
I'm not
China?
saying it specifically to anybody. I'm saying it to anybody that would ask a nasty question like
That's
that.
not a nasty
Please go
question.
ahead.
Why does it matter?
Okay, anybody else? Please, go ahead in the back, please.
I have two questions.
No, it's okay.
But
We'll
you
go over
pointed
here.
to me. I have two questions, Mr.
Next,
President.
please.
But you called on me.
I did, and you didn't respond, and now I'm calling on
Sorry, I just
the
wanted
young
to,
lady in the back, please.
I just wanted to let my colleague
Okay.
finish. But can I ask you a
Ladies and
question,
gentlemen,
please?
thank you very much. Appreciate it. Thank you very much.
And during these times, Trump is still pushing for repealing Obamacare?
The Trump administration has decided not to reopen Obamacare markets for people who don't yet have health insurance. Democratic lawmakers and two leading insurance industry groups were pushing for a special enrollment period in light of increased healthcare need due to the coronavirus. There's already a rule that allows people to sign up for Obamacare if they lose their employer's insurance coverage, but the special enrollment period would allow people who didn't have coverage already another chance to sign up. Some states have control over their own ACA exchanges, so 11 states and Washington, D.C. have launched temporary special enrollment period.
I think reopening too fast is very dangerous because, as with the 1918 pandemic, yeah, it did in some way wither away over the warmer months, but it came back in a huge wave the coming fall and winter. And that is exactly the point. We don't need someone in the highest office giving us positive reaffirmation that everything is going to be all right. That's not the job of the president. You're not a televangelist.
I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. The virus that we're talking about having to do, a lot of people think that goes away in April with the heat. Because of all we've done, the risk to the American people remains very low. People die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, view this the same as the flu. When somebody sneezes, I try and bail out as much as possible. It's going to disappear. One day, it's like a miracle. It will disappear. If you're healthy, you will probably go through a process and you'll be fine.
Of 1 to 10, how would you rate the response to this crisis?
I'd rate it a 10. I think we've done a great job. It seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job.
We just gotta listen to science here, not politicians who obviously think about one thing, getting reelected.
You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No, he's asking the question, when is it going to be deployable? And that is going to be at the earliest a year to a year and a half, no matter how fast you go.
You think that's right?
And as you said, because the treatment's going to be available before the vaccine. So that's why.
Well, I think treatment in many ways might be more exciting. Now the Democrats are politicizing the coronavirus. And this is their new hoax.
You tweeted earlier linking the closing of the country to your election success in November. Is this Easter timeline based on your political interests?
What do you mean by my election success? No.
You tweeted, you said that the media wants the country to remain closed to hurt your odds
No,
of
I think
being
the
reelected.
media, the media would like to see me do poorly in the election. I think
Lawmakers and economists on both sides of the aisle have said that reopening the country by Easter is not a good idea. What is that plan based on?
just so you understand. Are you ready? I think there are certain people that would like it not to open so quickly. I think there are certain people that would like it to do financially poorly because they think that would be very good as far as defeating me at the polls.
Which brings me to say that at this point, I am convinced that we got into this very mess because of Trump's only consistent policy, anti-Obama.
I mean, we've come a long way from an obsolete, broken system that I inherited. We have now tested with the best test far more than anybody else. And when I say anybody else, I'm talking about other countries. No country is even close.
No, I think we've done a really great job.
But the Obama administration, people from the Obama administration would disagree on your assessment that the cupboards were bare. They said that there was equipment.
I know, Jim. Let me just tell you. That's fine.
You say broken tests. It's a new virus, so how could the test be broken?
We had
needing
broken
new test.
Jim, we had broken tests. We had tests that were obsolete. We had tests that didn't take care of people. But here's what's very important. If you take a look at the swine flu, H1N1, or as Joe Biden would say, N1H1, but it's actually wrong. He didn't even know the name. Okay, H1N1, the swine flu. The Obama administration was a disaster. And they did polling on how did they do. And their polls were so negative, so bad. They did a very poor job. And they did a poor job on a lot of things. They did a poor job on our military. They did a poor job on our ammunition. When I got here, we had no ammunition. Just like we had no ammunition, we had very little medicine. We have a problem that a month ago nobody ever thought about.
I think everyone in this room probably shares that concern. Your own Health and Human Services Secretary was aware that this had the potential of being a very big problem around the world, a pandemic of this nature. Who dropped the ball?
Well, I always knew that pandemics are one of the worst things could happen.
Oh, did you know? Did you know? Well, as Foreign Policy reported as early as January 31st, 2020, he disassembled and fired the government's entire pandemic response chain of command. America went from somehow prepared to completely not prepared, with the Trump administration scrambling around to recreate something.
You said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know about the reorganization that happened at the National Security
It's the administration.
Council.
Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was
Please go ahead. We're doing a great job.
So where do we go from here? The CDC went on to explain why there's a disproportionate effect on minorities. The CDC believes that there are three main reasons why there are health differences between racial and ethnic groups, and it comes down to economic and social conditions. First, living conditions. The CDC believes that racial and ethnic groups live in more densely populated areas because of, and I quote, institutional racism, used by the CDC verbatim, in the form of residential housing segregation. Many also live in neighborhoods that are farther from grocery stores and medical facilities, making it more difficult to receive care if sick and stock up on supplies that would allow them to stay at home. Racial and ethnic minority groups are also overrepresented in our jails, prisons, and detention centers, both public and private, which have specific risks due to congregate living and shared food service and more. Second, work circumstances. Many racial and ethnic minority groups are critical and essential workers who continue to work outside the home despite outbreaks in their communities, including some people who may need to continue working in these jobs because of their economic circumstances. Workers without paid sick leave also might be more likely to continue work even when they are sick for any reason. Third, and I think the most important, lack of access to healthcare. African Americans are almost twice as likely to be uninsured. In all age groups, blacks were more likely than whites to report not being able to see a doctor in the past year because of cost. The CDC published all of this, and the CDC is giving us a recipe for systematic change. Corona has shown us that our unemployment system is a mess. Even when you're employed, you're still not adequately protected. Our healthcare system is a mess, especially if being tied to employment and being unaffordable. Inequality is a continuous problem. Mass incarcerations have also resulted in private and public prisons becoming petri dishes. We need reform, and we need to get our priorities straight. This is really the time to start talking about universal healthcare, and most importantly, reforming our labor system, workplace benefits, the right to organize, and enacting wages that really reflect how essential these workers really are. And to conclude, I think that people that voted for Trump, and you probably know many, friends and family, distant relatives, they all had some good intentions. For many, it was a vote for the survival of America. They thought that Trump would fight corruption, ironically would fight money in politics, and solve many of their economic anxieties. Once Hillary got the nomination, it was no surprise that there were enough first Sanders, then Trump voters that swung the election towards Trump in Michigan, Wisconsin, Pennsylvania. But by using Machiavellian-type strategy, literally straight out of Trump's book, he conned many into thinking that he was the answer to take on the government. And this sentiment still exists. We don't need a self-centered, egomaniac billionaire Trump. We don't need Republicans. We don't need Democrats. We need reform. We need to start organizing and, maybe check out Biden's 30-year not-so-forgotten plan to help us move towards publicly funded elections.